Okay. Hi, good afternoon. I was really excited to have a chance to talk about this topic. Most of the time when I see people, they've got health concerns, they're in some type of disease state, or they're uncomfortable about something. And I know that there are so many ways and things that we can change about our lifestyle and our nutrition that's going to keep us from deteriorating or from suffering from some of these diseases of aging. And so I'm really happy to be able to share this topic with you. Our quality of life and our productivity as we age is very dependent on nutrition and our lifestyle. And I was fortunate enough in my late 30s, I guess it was, to come across the writings of Gail Sheehy. She's a sociologist and an author. And it's very worthwhile, her philosophy of aging. She describes the stages of our lives not as middle age and old age, but she refers to them as a series of adulthoods. And so she refers to the first adulthood, we're in our 20s and 30s. And then in our 40s, we enter a second adulthood. And that was very encouraging to me in my late 30s, because turning 40 was kind of upsetting. And so this is, something that, a place where you can redefine your goals and you can decide what you're going to do differently going forward and make some changes to improve your health. So wherever you're at, whether you're in your second adulthood or you've actually entered your third adulthood, there's always things that you can change. And some of what we encounter as we age is genetic. But most of the time, genetics gives us a predisposition to something, but doesn't actually mean, sometimes it's, it does follow through, but it doesn't necessarily mean that it will. And so things that you choose to do can mediate that. And just because your parents suffered with something doesn't mean that you necessarily need to. So the three leading causes of death are heart disease, cancer, and stroke. And they're all preventable. Our nutrition needs change as our bodies change with age. Absorption of nutrients becomes less efficient. Our immune systems start to break down. We become more sedentary, spend more time indoors. Sometimes there's an increase in medications that changes our nutrition needs. And in advanced years, there's often a decrease in appetite. Some people have trouble food shopping or with food preparation, and so this does impact their nutrition needs. Some of the common deficiencies and increased needs as we get older. B12, about 15% of the population as we age becomes B12 deficient. And this tends to be because of either a decreased absorption, sometimes stomach surgery changes, because in order for us to absorb B12, our stomachs produce something called an intrinsic factor. So if there's any kind of stomach involvement, any kind of stomach ailment, it could change how much B12 we're absorbing. It's a simple blood test, so it's something that can be monitored. If you've been diagnosed with a B12 deficiency, most often the doctors might recommend B12 injections. Just so that you know, you could always ask the doctor about sublingual B12. You can buy it over the counter. It's a tablet you put under your tongue. Most of the time when doctors are asked if you can use a sublingual supplement, they say yes, of course. And that eliminates the having to go and get injections or having to take the time to go to a doctor's appointment. So it's something to watch for. Folic acid, it's part of the cardiology protocol because a deficiency in that causes cardiovascular disease. 400 micrograms a day is the recommended amount that you should be taking in. And you can find it in fortified products like cereal and in green leafy vegetables. It's not necessarily something that you have to supplement unless the doctor suggests it at this time. Calcium, another thing, our needs change for calcium with age. As we get older, we need more calcium. Everybody over the age of 65 should probably be taking in 1,500 milligrams, or if you've been diagnosed with osteoporosis at an earlier age than that. It's important for bone health. It's also something that's going to help with arthritis symptoms. And I'll highlight which ones are for arthritis, since that's a common ailment as we age. Also, if you suffer from muscle cramping in your calves in the middle of the night, sometimes a cramp will wake you up. That's sometimes indicative of a calcium deficiency. So you might want to address how much calcium you're getting in your diet. Certainly, if you're a milk drinker and you're taking in 3 to 4 servings of dairy a day, you might not need to supplement. But a lot of times as we get older, we're not drinking in that much milk. Vitamin D. Latest research is showing a high amount of deficiency, and this could be for a number of reasons. One is that the RDA might have been set too low. We've always thought, a lot of healthcare professionals have always thought that vitamin D was set too low. At 200 to 400 international units, it wasn't enough. They're looking at setting it now at 800. I know a lot of health practitioners that are suggesting 1,000 to 2,000 international units a day. Not only is it important for bone health, it's also part of that arthritis protocol, but it's also really important for your immune system. Okay. Zinc, your body needs 12 to 1,500 milligrams a day, but it's not recommended that you supplement with zinc, because when you start supplementing with metals, you can throw all the balance of metals off in your body. So unless somebody tells you that you need it, I wouldn't do it. It's important for immune function, but you can definitely get it from vegetables, especially your green leafy vegetables. You're going to get tired of hearing me say green leafy vegetables, but they're that good for you. Iron, body needs about 10 to 15 milligrams a day. Another thing that you don't want to supplement unless you're deficient. The one thing about iron deficiency is if by chance you are told that you're iron deficient, it's a good idea, unless you can identify why with the doctor, that you follow it up with a visit to a gastroenterologist, because as we age, if you have iron deficiency anemia, a lot of it can be indicative of a loss of blood, usually in your gastrointestinal tract. So something for you to just keep in mind. Lutein, that's along with zeaxanthin, is very important for eye health. If you have been told that you're at risk for developing macular degeneration, that, along with vitamin C, vitamin E, zinc, and copper, is put into vitamins marketed as Ivites and Ocuvites. That's just 2 of them. There might be others on the market, but those are the ones I know well. And so if you're at risk, there are vitamins and minerals that you can take. It's difficult to get enough of the lutein into your diet if you need it, if you need more of it, if you need to supplement it, because I always refer to foods that you can take into your diet to get what you need, because it's always preferable to eat it in the foods. But for enough lutein, if you happen to be at risk, you need something like 59 oranges or 83 cups of blueberries to get the right amount. So it's really not, it's not realistic. Lycopene for prostate health, very easy to get that in your cooked tomato products. Selenium, a very important antioxidant. We're going to talk a little bit more about it later. The literature will show supplementing with anything from 50 to 400 micrograms a day. And CoQ10, another one that's been heavily researched lately, and it's found that we actually lose a lot of the ability to synthesize it as we age. So if it's something that you want to supplement 100 milligrams a day, it's a good energy carrier, and it's very important for brain function. So what accelerates the aging process? Stress, free radicals, we'll talk more about them, saturated and trans fats, sugar, starches, a weakened immune system. And all or almost all of the disease processes in our bodies start with inflammation. Stress, along with diet, smoking, dehydration, poor oral hygiene, and environmental pollutants can induce systemic inflammation. So how are we going to get rid of the stress, which was first on the list? Well, a lot of times, to be able to reduce the inflammation from stress, if you eat smaller, more frequent meals, eat less processed food, balance each meal and snack with a little healthy fat, a little lean protein, and complex carbohydrates. Eat more vegetables. The American diet is highly acidic, and the vegetables will actually balance it out and make it more basic. It's healthier for you. And besides that, the vegetables bring in a lot of the vitamins and minerals our bodies need. Eat fruit for vitamins, minerals, and fiber. Beans, lentils, and grains for the B vitamins and for fiber, and also because beans and lentils are a non-animal source of protein. And fish for omega-3s and magnesium. And don't forget water. Everything that goes on in our body goes on in water, so we need a lot of it. So you can prevent or reduce the decline in health by eating foods that are anti-inflammatory. And this will support healthy body systems and boost the brain. Antioxidants. Antioxidants help prevent cancers, cardiovascular disease, they protect our memory, they ward off wrinkles, they protect our joints, reduce pain, and they safeguard against macular degeneration and cataracts. So we have antioxidants. What are they anti? What are oxidants? Oxidants from pollutants, X-rays, chemicals, stress, even food. Even digesting food causes these oxidants in our bodies, these free radicals in our bodies, and sunlight. So what happens is that the antioxidants convert these free radicals, that's what's damaging the molecules in our bodies, into non-harmful substances. Too many of these free radicals is going to lead to stress in the body and this inflammation that we've been talking about. So the antioxidants are going to protect the body against wear and tear. And these are found in our vitamins and phytonutrients or phytochemicals, which we're going to talk some about, but they're not vitamins, they're not minerals. That's a part of our foods that they've called them phytonutrients. So some of the ones that are outstanding, the outstanding antioxidants. Vitamin C, it's received the most attention for decades. It was the first one that was heavily researched, and they have found it to prevent heart disease, stroke, cancer, diabetes. It's important for collagen, so it's important for the skin, for healing, for blood vessels, tendons and ligaments. It's part of our bones and our teeth, all the body tissues actually. And vitamin C, whether you take it ingested or use it topically, has been found to reduce wrinkles. It's not stored in the body, so it's a good idea to take it in daily. You need 75 to 90 milligrams of it to keep yourself from getting sick from something like scurvy. But in order to take it in as a therapeutic antioxidant, it's about 400 milligrams a day. Some people supplement, you'll hear, you'll go to look at the supplements. They usually start at about 500. It's not stored in the body, so it's a safe supplement. I gave you a list of foods that have the most vitamin C in them, and along with these foods, you also find it in walnuts, almonds, sunflowers, dark leafy greens again, whole grains, avocados, vegetable oils, and sweet potatoes. Flavonoids is another antioxidant, and there's a lot of subgroups to this. It was only started to be heavily researched in 1995 because of its diversity and complexity, so it really stumped scientists for a while. It's responsible for the colors in fruit. It's also protective for your heart and against cancer. It's a strong anti-inflammatory and antioxidative agent, so it's going to cut down on the wear and tear in the body. Greens and black teas are a very potent source, and it's also found in red wine, onions, and soy. The other subgroups of this is quercetin, which is the active ingredient in apples. So now you know where the expression "an apple a day keeps the doctor away" came from, although when they coined that, they really didn't know about quercetin. Quercetin's also in onions, whether they're red, yellow, or white. Resveratrol, that is that healthy part of the skin of red grapes. That's why wine is so healthy. And isoflavones that you find in soy. Okay? So it's a good idea to mix them up and take in a lot of different colorful fruits and vegetables so that you get the most absorption and the greatest effects from them. Polyphenols is a type of flavonoid, and it happens to be the most abundant antioxidant in the diet. Again, it's protective against coronary artery disease, peripheral artery disease, slows down skin wrinkling. It inhibits tumor growth. It prevents bone resorption in postmenopausal women, so it's good against osteoporosis. And you find it not only in teas, but you find it in coffee as well. So you can choose the rich colors that, you know that red grapes are healthy for you, but if you're also looking for more of the same, you can get from red potatoes and pomegranates, so don't limit your diet to just red grapes. Black rice and purple barley are going to bring in as much as blueberries. Dark chocolate, that's what makes dark chocolate healthy for you. And another antioxidant are the carotenoids, and this also protects the body against wear and tear. It boosts the immune system. Lycopene is one of the carotenoids that we talked about a couple of minutes ago as being important for prostate health. Again, we talked about lutein as far as eye health. Some of the sources, food sources for lycopene besides the cooked tomatoes are red peppers, pink grapefruit, watermelon, and papaya. And for lutein, you can get it besides the dark greens, you can get it from Brussels sprouts and egg yolks. Luteolin is important for cognitive decline, and that's also not only in carrots and bell peppers, but in rosemary and thyme. So you can't forget about your herbs too. Beta-carotene, which is converted to vitamin A, you might have heard about it in its vitamin A form. It's important for cell division and differentiation. It's also important for immune function because it's necessary for making of white blood cells, which fight infection and viruses. But you're best to get it from foods as opposed to supplements because the body can store vitamin A, so it can be toxic. So taking a vitamin A supplement is not a good idea. But you can eat food sources like carrots, butternut squash, sweet potatoes, so the orange foods for sure. But you'll also get a lot from spinach, kale, cantaloupe, fortified milk, and oatmeal. Now, there are more foods with other antioxidants that I just want to touch on. So here's a list, some things that you might not have thought of. Avocado, great healthy fat for you to add and help the body out. Besides the folate, it's potassium, vitamin B6, important for the immune system, and fiber. Curcumin, which is found in turmeric and curry powder, is very important as an antioxidant as well. And the broccoli, because of the sulforaphane, it actually is thought to seek out and destroy cancer cells. So it's very important. It's also very important for steroid hormones, which are your sex hormones, keeping those at a healthy level while you age. I talked about the color of fruits. Yeah?
I have a question in regards to the fresh fruits and vegetables. I'm always questioning when I'm purchasing some items. Do you go to the organic, or are the products that are treated with pesticides, if you wash them?
Right. I was actually going to talk about this a little later on. If you think about it in terms of the fact that organic vegetables are grown without the pesticides to keep away the environment, and they're also grown without the preservatives and the ripening agents that are added to them, and without those, they actually are growing and thriving stronger because they have to fight the environment. So yes, they tend to have more antioxidants in them because of how they're grown without help. And so yes, they tend to be higher in antioxidants. There's always a big question as far as how important is it, and it's a very personal decision, okay? In a perfect world, we'd all be able to pick and choose what we wanted to eat. Since I basically eat a plant-based diet, it became prohibitive. I'm a family of 4, and so it became prohibitive for me to be able to buy everything organic. So there's a list, you can go online and get it, or I can email it to you. There's a list of the dirty dozen. Most of the things that absorb the most pesticides is fruits. So if you can buy most of your fruits organic, and then there's a couple of other vegetables on the list and things, then that's one step towards, so if you have the choice, buy organic. But I certainly wouldn't let it limit you, because some things that are very healthy to eat are difficult for us to get organically, especially since our season is very limited here in New York. So we're fortunate. What's that? What about milk and eggs? Yeah, well, yes, because first of all, organic milk, it's interesting because I used to balk at the price of it because it could be very expensive. However, I don't know anybody here, if you're using organic milk, if you've noticed that the shelf life is considerably longer. So where I used to toss milk after 5 days, when I buy organic milk, it's on my shelf in the refrigerator for a long time, like weeks if we're not drinking much of it. As far as eggs goes, the free-range, uncaged animals produce better, produce healthier food. Yeah.
To add to that, the cost, I only give my children organic milk. If you look at it and extrapolate out the price, it's $2 extra a gallon.
Right.
And if you do, I mean, to me, it's worth every penny because they're...
Right, I was just being sensitive to people that you're absolutely right, but I was just being sensitive to people that might not have the extra $2. But if you think about it in terms of, well, you have to toss the other milk sooner, so you're spending $2 extra, but you're getting 2 weeks out of the milk or something. I mean, you know, some people don't have kids that use up the milk fast, and you're just using it in your cereal and coffee and stuff, and all of a sudden you find yourself dumping, dumping food that's gone bad. So it lasts longer. And for anybody that doesn't drink milk or doesn't want to drink cow's milk, soy milk is fortified. So if you're looking for a calcium source, you should be able to get it from other milk sources. Did I answer your question? That was good. Okay.
Thank you.
Sure, no problem. So as far as we were talking about before about the color of, just don't want to walk into that. The color of things, well, white vegetables and fruits also have antioxidants called indoles and isothionates. And so I provided a list of the healthy white things. We don't always have to eat just color. And also, as I referred to before, don't forget about your herbs and spices because those are full of phytochemicals, especially cinnamon and cayenne and the turmeric that I mentioned before. The other thing besides the antioxidants that it brings to the diet, the fact that if you use more herbs, you possibly can cut down on the fat and sugar that you're putting in your food for taste so that you're eliminating some of those inflammatory foods as well. So here's some suggestions how to apply what we've covered so far as getting some more leafy greens into your diet. If you haven't tried bok choy or things like that, you might want to go and learn something new. If you ever want to try something new and you can't figure out how to cook it, your computer's going to tell you everything that you need to know. You can mix mustard greens and chard and other salad greens, although some people prefer to eat it cooked. You can use broccoli, slaw, and sprouts in your salad, not just the typical lettuce, tomato, cucumber. Great summer salad, arugula and watercress with some fruit and a lemon vinaigrette. And Brussels sprouts. I always hear people say, I just can never taste them because I don't know how to cook them. So I figured, well, since that's mostly the comment about Brussels sprouts and they're so healthy for you, just trim off the bottoms, cut them in half, chop up an onion, saute them up. You're going to love them. We were just talking about the organically grown, so I'm just going to slip right over this. And also, be careful not to overcook your vegetables because the cooking will damage the phytochemicals in them. So you cook vegetables. In fact, some of the vegetables that we eat, when they're cooked, they release more of the nutrients. But I'm talking about the overcooking or the prolonged cooking. And then there's fish. There was a study done recently that showed that eating at least 2 ounces of fish and then taking a test increased the score, the cognitive score on these tests. So it takes very little for the body to benefit from the fish. And it's not just the omega-3s, although those are important. And the two that are most important that are found in fish are DHA and EPA. There's a third omega-3 that you'll hear a lot about called ALA, alpha-lipoic acid. It actually is very healthy for the body and helps decrease your risk of cancer. But as far as if you're looking at it in terms of heart health, it's the EPA and the DHA that you're looking for, which you're going to find in fish. And it's difficult for the body to convert intake of other oils to this EPA and DHA. We have to take it in our diet. It lowers triglycerides, it reduces arthritis symptoms, and when it comes to, we were just talking about the organics, then we were talking about the chickens, but even in terms of cows, grass-fed animals have more omega-3s, even if it's beef you're eating. Grass-fed beef has more omega-3s in it than the corn-fed beef. So it's very important when you're choosing any animal proteins. If you can get grass-fed animals, it's much healthier for the body. The omega-6s, by the way, increase inflammation in the body, and that's why you want to have a good balance between your omega-3s and your omega-6s. The omega-3s also reduce the risk of Alzheimer's. And again, important for an anti-inflammatory diet. And it's also important, it's an anti-clotting. It actually helps the EPA and the DHA, the omega-3s, help produce products of the blood that are anti-clotting. So that means that the blood's going to be less sticky, it's going to flow better. One thing that is under investigation, and you might hear a lot about coming up, is pine bark extract. It has been marketed for years as pycnogenol and was always known to be a good anti-inflammatory. It was one of the earliest supplement remedies as an anti-inflammatory that I can remember. But research now is showing that it is extremely helpful, a powerful antioxidant, and you know, there's not a whole lot of supplements that they can attribute to even like diabetes and things like that. So might decrease blood pressure and cholesterol, which would be great. They're investigating that now. A lot of people that I speak to, they have been following the media reports about the acai berries and goji berries, and there is no scientific evidence that supports the claims that are in the media as far as preventing cancer and anti-aging. So eat or drink whatever it is that the products that you hear about with just a touch of skepticism. So research shows that it's a diversity rather than the quantity of anything that's going to be more protective and preventative, because, you know, again, it's varying a plant-based diet that is going to keep you the healthiest. So again, some new other ways to possibly use this information, whether you use it for snacks or breakfast, using low-fat yogurt, blueberries and almonds would be a great way to get some of these antioxidants in, or oats and strawberries for breakfast. Lunch, use arugula and spinach, a quarter of an avocado, 3 ounces of salmon, and half a cup of beans. You're incorporating all these nutrients. Dinner, 6-ounce fish, 6-ounce sweet potato, and a cup of Swiss chard, and you've got health on a plate there. So we also mentioned that our immune system starts to break down, so let's take a look at strengthening our immune function. We talked about the B vitamins. Vitamin B6 is very important for a healthy immune function, and I also mentioned the vitamin D. But what about getting enough sleep? And this is sort of like a catch-22, because as we age, a lot of us start to have trouble sleeping, especially if it's hormone-related or something like that. It gets kind of tricky. 7 to 9 hours is important for peak immune function, and even minor sleep deprivation causes inflammation in the body. So that would affect maybe your digestive system, your cardiovascular system, and your central nervous system. And just as a little tidbit, 80% of people who are obese and have diabetes have sleep apnea, 80%. I don't know how much it is for the population that is just overweight, but it's still pretty significant. And I also have to tell you that in the past couple of years, now that I watch for it more, I am really surprised at how many normal weight people have sleep apnea. So if anybody has ever commented to you that you snore or stop breathing in your sleep, or if you happen to wake up not feeling fully rested or feel like you need a nap in the middle of the day, please go talk to your doctor. Physical activity, very important for the immune system. 30 to 40 minutes of aerobic activity strengthens antibody and T-cell responses. Those are your disease fighters. And I'll have more to say about physical activity. Good dental hygiene, floss and get regular cleanings, because the bacteria that causes gum disease is also causing an inflammatory response and is responsible for heart disease and diabetes. Cruciferous vegetables, that's your broccoli, cabbage, cauliflower, Brussels sprouts, bok choy. Eat them 3 to 4 times a week unless you have thyroid issues, because it's going to also strengthen your immune system according to research. Consume natural sources of selenium and zinc. And as far as the zinc goes, good sources of zinc would be oats, whole wheat, rye, lima beans, almonds, walnuts, green peas. Believe it or not, listening to upbeat music actually strengthens your immune system. So they have found 50 minutes a day. It boosts the antibodies in our body, destroying bacteria and viruses, and it also decreases stress hormones. So give that a try. I used to hear that about classical music, but now it's basically all upbeat music. Tea, very powerful for the immune system. And as far as another part of our immune system that we usually don't consider is our digestive system. Our digestive system is constantly exposed to toxins, and it actually provides for 50% of our immune response. There are 100 trillion bacteria living in that one ecosystem, and those are all bacteria that start to grow after birth. Some of them are supposed to be there. That's good bacteria versus bad bacteria in our intestines. And the good bacteria, it's sometimes tough to maintain those levels of good bacteria if you think about all the harmful bacteria that we're probably ingesting with our foods. So the ones that you really know about because you hear it in the news, I mean, everybody hears about that when the food is tainted with E. coli or salmonella. But the good bacteria, the healthy bacteria, is that's actually going to promote a healthy immune system. So we're talking about the bad bacteria thriving if we have an unbalanced diet, stress, fatigue, antibiotic therapy. It's a really good idea to take something when you take an antibiotic to be able to promote the healthy bacteria in your body, and that is probiotics. And probiotics restore the balance between the good and the bad bacteria. And they are also very strain specific. If anybody in the room has any type of intestinal issues, you might want to consult with me or your doctor about a specific probiotic that might be better for your situation. The probiotics actually enhance immune cells. They keep healthy people healthy. They have found that people on probiotics have fewer illnesses and have shortened length or severity of the common cold. The ones that you can find easily in the stores, the Dan Active is the yogurt with live cultures in it. And then if you would like to, let's say you're on an antibiotic or you have some digestive issues and you want to try probiotics, Culturelle is readily available in the stores. It's a little less expensive than some of the others. A month's supply is probably about $17 to $20. Reason why I'm mentioning this is because these things can get a little costly. And another product that's very helpful is the Floristore. Just be careful when you're buying supplements because the market is unregulated, and you want to buy from a reputable company because otherwise you don't know if it's tainted or it has any other harmful substances or toxins in it. Be wary of marketing claims. You know, there's always something people jump on, like, you know, fiber. The media said that fiber was good for you, so then all of a sudden there were 500 products on the market that had fiber in them. Okay, fiber doesn't naturally occur in cheese, you know, so if the cheese had fiber in it, it's a marketing thing. It's not something that's necessarily going to be good for you. So be careful. The catchword now is probiotics. So if they're telling you that it's in cookies and cereal and things, it's not going to be good for the body because it's not in a live form. So another way to incorporate this information into a way of eating is the Mediterranean diet. And I refer to the Mediterranean diet. A lot of the research has been done on the diet from Greece, but it really incorporates most of the countries around the Mediterranean follow the same type of eating principles. This type of diet has been found to decrease LDL cholesterol and triglycerides. It improves blood vessel function, it lowers blood pressure, it improves heart health, decreases cancer risk, decreases cognitive decline. They actually found that eating a Mediterranean diet lowers Alzheimer's risk by 40%. And so the components of it is use monounsaturated fats. Most people use olive oil in that respect, but canola oil, if there is you know, some type of food that you're making and you don't want to impart that strong olive oil flavor, canola oil is a monounsaturated fat. Eat a low intake of saturated fats, moderate intake of alcohol and dairy products. Make sure they're low-fat dairy products. The low intake of meat, yeah? Macadamia nut oil, if you're going for the nut oils, peanut oil actually has the most monounsaturated fats in it, but all nuts, right, all nuts are high in fat.
Well, no, the macadamia nut oil has less fat than peanut oil, right?
Negligible? As far as I know, negligible. I mean, I might have to look that up again, but as far as I know, negligible. All the nut oils are going to, you know, every teaspoon of oil has about 5 grams of fat in it. So it's the quality of the oil that you're choosing to use. As long as you're using a healthy fat, and so if you're looking at oil, using a small amount of oil is the healthiest, as in sauteing or pan frying instead of deep frying. And the quality of the oil. So instead of using, I mean, the vegetable oils are not necessarily unhealthy unless you're using too many of, let's say, the sunflower, safflower oils and corn oils, and not enough of the monounsaturates like the olive oil and canola oil. A high intake of vegetables, fruits, whole grains, legumes, nuts, and fish in the Mediterranean diet. And, you know, it could be how all of these things work together that makes it more beneficial for the body. You know, they've tried, certain companies have tried to extract these chemicals and phytonutrients that they find in food. You know, everybody wants to package that magic pill. And basically, they don't get the same results when they take out the active ingredient. They tested soy proteins, and then they tested just like the soy powders that they made out of them to see if they would get the same results. And they didn't. So it's actually some type of synergy with the chemicals in the food that are making them more healthy. So basically, we're looking at aiming for 8 to 10 servings of fruits and vegetables a day, which sounds difficult to some people, but if you consider that a half a cup of cooked vegetables or 1 cup of raw is 1 serving. So if you try to incorporate some vegetables at lunch, maybe lettuce and tomato on your sandwich, maybe you're going to have baby carrots instead of your chips. If you have a salad before dinner and possibly have some broccoli or spinach or something, if you think about it, if you actually measured it out, you'd probably get pretty close to coming up with 4 or 5 servings that you could have of those, and then your fruits, whether you're having them with your meals or with snacks. Yeah?
Have you heard of something called, or how do you feel about the product on the market called Juice Plus?
Any juices is,
Well, it's not like, it's something that, I think it's called Juice Plus. It's something you take that it's serving the fruits and vegetables, but it has no sugar.
Are you, is it the ones that come by the shot, or they're coming as an 8-ounce serving? Haven't seen any of the research on that. Mostly what I'm seeing are the little shots of berry juices.
It's called Juice Plus. I think it's a pretty sure it's Juice Plus, and it's like a fruit snack. Like you take 2 in the morning, 2 at night, and it's something that you.
Just for the vitamins and minerals?
It's I think 12 to 14 servings of fruit and vegetables a day, but it's no sugar. It's like.
That also means that there's no fiber and there's no. Always better. My philosophy is it's always better to eat the whole food, across the board. No, because the body, the sugar that you get from fruit is not the same to the body as the sugar, like your table sugar, like your white sugar. The body actually is made to fuel on carbohydrates. And the carbohydrates in fruit, in whole fruit, is absorbed slowly by the body, and it's the healthiest version of it. If you are taking just supplements, then what are you fueling the body with? If you are taking in vegetables, there's very low amount of carbohydrates in vegetables, and it's mostly in a starch form, not a sugar form, and therefore it brings relatively very little carbohydrates into the body, which means that if you're living on a plant-based diet, you're living with beans, legumes, and your fruits and vegetables, you're probably taking in an appropriate amount of carbohydrates into the body. When they talk about eliminating sugars, it's really mostly like processed, any type of processed foods. Just to put it in perspective, even people with diabetes are supposed to eat fruit. Atkins made everybody carb phobic. The body actually is built to fuel on carbs. Less than 130 grams of carbs a day is actually unhealthy for the body. Just keep in mind. So eating a rainbow, again, best way to keep the body healthy. So I sort of arrange things for you by color. Food and mood. Proteins, important for alertness. You might find that if you start incorporating some egg whites into your breakfast, or low-fat cheese, or Greek yogurt, that your morning improves. Carbohydrates relax you, and that's why they're our comfort foods. And by the way, there's nothing to a high-protein diet that is going to help you lose weight, except for the fact that our comfort foods are foods that we tend to have trouble portion controlling, and so eliminating them eliminates that I want a plate of pasta kind of thing instead of just a portion the size of my hand. Low-carb diets actually may adversely affect mood. I don't know if you know anybody that's been on the Atkins diet. Hopefully, they didn't suffer the terrible headaches that I know people can suffer from by starving their brains. But yes, it makes people very moody and actually depressed. As far as reducing depression, fruits, nuts, legumes, monounsaturated fats, very important. In fact, omega-3 fatty acids are actually very important as an antidepressant and can actually help if you're on antidepressants. Too much meat and dairy actually increase depression. And a lot of this has to do with the brain chemicals, okay, serotonin being one of them. And carbohydrates actually affect the serotonin levels of our brain, increasing them. I warned you against certain supplements. I just wanted you to have a list of the ones that were safe to supplement with. And the ones with warning labels. We mentioned the vitamin A being problematic, and these are your good food sources. Vitamin E, another one that's stored in the body, not necessarily encouraging you to take it as a supplement unless you're being directed by a health professional. We talked about the iron, we talked about the zinc, and here are some food sources. Just remember when it comes to supplements, if it sounds too good to be true, it probably is. It's a good rule to follow. And also, anything that's marked natural and herbal is not necessarily safe. Basically, be skeptical. Do your research if you're going to take something. So whether to supplement or not, basically, if you can get what you need from food sources, it's always a good idea. One of the things that I think is, across the board is going to become a mandatory, or not mandatory, but a more of a need for supplementation is the vitamin D. And one of the reasons why I think it's where we've got that more and more deficiency of that is because hopefully people are using sunscreen. So whereas we used to get the vitamin D, you absorb the sunlight and it converts in the body, but now that hopefully we're all wearing sunscreen because we want to be protective against skin cancer, we're not getting enough of that. Okay, so also the other thing as far as lifestyle goes to increase our quality of life is exercise. And actually walking slows your biological age. They have found that walking an hour a day, 5 times a week, slows your biological clock by 10 years. Physical activity is important for both the mind and the body. It strengthens muscles regardless of age. They've done studies where they've taken deconditioned people in their 80s and started working with them and found that they were able to build muscle, so it is never too late. It is really important to preserve or increase lean body mass as we age. One of the reasons why is because it actually starts to break down. And it starts to break down as early as 30. And the other thing is that it increases our metabolism. Okay, it's body fat around the waist that is the most dangerous. It's most dangerous for our hearts and our livers. And exercise, especially weight-bearing exercise, can decrease or prevent osteoporosis. Exercise is very important as we age to prevent falls and fractures. I read a statistic this week that 40% of people past the age of 60 are at risk for a fall and fracture. I thought that was a lot of people. Exercise is going to increase our mobility. And exercise doesn't just have to be, going to a gym or, doing that 60-minute walk a day. It could be non-exercise, which a man named James Levine coined non-exercise activity thermogenesis, but that's a mouthful. So basically, I call it the old way, is activities of daily living. And activities of daily living is just move more and sit less. And that actually contributes to your physical activity and your health. So basically, walking here for lunch, from the office, pacing while you're on the phone, using the stairs as much as possible, even chores like cooking and folding laundry, burn calories and move the body and strengthen our muscles. Take a catch-up walk with somebody instead of chatting with them on the phone. And if you happen to be a couch potato at night and love just sitting and watching TV or a movie or something, what about getting yourself a treadmill or a stepper? They have steppers that actually are about this big. And just try doing something like that for at least a half hour in the evening, and that will improve your health. Activity leads to a higher rate of free living. Active people have cells that are up to 9 years younger than couch potatoes. So, like I said, 30 to 40 minutes of aerobic activity is what's important, both for the mind and the body. The American College of Sports Medicine reports physical activity in middle age makes participants more than 50% less likely to develop dementia. And and again, it's important for the brain. Don't forget about strength training. Only 14% of men and 11% of women 65 or older perform strength training activities. It's very important. It's never too early to start. And don't forget about balance training and flexibility. If you're looking to do something to improve your balance and flexibility, you could do, and not anything strenuous, you can look into Tai Chi and yoga, both very smooth, safe practices for the body. It's important, if you haven't been doing anything, to remember to start from where you are and not feel like you should push the body. You don't believe in no pain, no gain, okay? Start from where you are. If you haven't been walking and you can start walking 10 minutes a day, that's wonderful. And so you can start out just doing something as what level you're at. Contraindications to exercise, you can just read through these. Everybody has a copy of the slides. I'm just afraid I'm going to run out of time, so I'm talking faster. Any of these pertain, and please do not exercise. Consult a physician. Medications change our nutrition needs sometimes, but if you change your diet, you possibly could reduce your drug therapy. There are food and drug interactions. The two main ones are grapefruit, with beta blockers, vegetables, and Coumadin. If you wind up on Coumadin, please know, you're not supposed to stop eating vegetables. You're supposed to eat consistent amount of vegetables and match your Coumadin levels to your vegetables. The vegetables are the healthiest things you can eat. The other thing is black licorice has a little bit of an interaction with some medications. If you're on medications, please make a list of them and put them behind your driver's license. My daughter is an EMT. If anything happens to you, if you're incapacitated in any way and somebody calls an ambulance for you, the first thing they do is open up to get your identification. The next thing they do is they're going to look behind your license to see if you're on any heart medication, diabetes medication, high blood pressure medication. Just write it down, because it's the best way that they're going to be able to help you, okay? The other thing is the next thing they do after that, and don't worry, somebody's working on you and somebody's going through your bag, so but the next thing they do is they open up the phone and they look for a listing in case of emergency. And it's easier to just type out ICE in your phone. They're going to open your phone, they're going to scroll down, they're going to look for that ICE. If they find it, that's the person that they're going to call and let them know that you're hurt. So put it in your phone. Probiotics. When you're taking antibiotics, take a Culturelle. I can't tell you how many times people have called me. They have such stomach problems from the antibiotic that they're on, and I tell them to take the Culturelle, and I usually get messages that they love me afterwards. Oh, and if you take any supplements at all, herbal, vitamin, mineral, anything, make sure you tell your doctor. When he walks in the door and starts talking to you, make sure that that goes down as a list of an update of what you've been doing. Very important, because some of the things you may be taking might impact your medication, an upcoming surgery or procedure. Very important to always share that information with your doctor. During illness and recovery, it's going to happen to all of us. If it hasn't happened yet, your protein needs might increase. Make sure that if you're heading into some type of surgery that you meet your protein and calorie needs beforehand so that you heal faster. If you have to increase calories without increasing volume, there are certain things you can do. If you don't have a fat restriction, you can add creams to soups, butter to bread. You can eat ice cream and cheese. How wonderful would that be? If you have lipid issues and you have to stay away from the fats, use evaporated milk. There's fat-free evaporated milk you can add to soups. You can add honey to bread, fortified pancakes. You can always, for increased calories, use dried fruit and nuts. There's a lot of calories in a small amount. Pastas and grains, shakes. You use shakes. Sometimes people do well with that. Peanut butter, a lot of calories in a small amount. And puddings. Products like Ensure and Boost, that's going to bring about 350 calories for an Ensure, 8-ounce Ensure, 250 calories for an 8-ounce Boost. If that's not appealing to you, just hit the Carnation Instant Breakfast, whether it's powdered and you put it in skim milk or regular milk if you need the calories, and or if you buy the cans. It's a good way to get some extra calories in if you're not feeling well, and like if you just don't have the energy to cook whole meals, some of these foods might help. Promod and whey powder, those are protein powders that you can add to foods. Promod is from egg whites. Whey powder is from whey protein. Remember to eat small, more frequent meals. And older adults dehydrate very quickly. So keep that in mind. Make sure that you keep drinking enough adequate amount of water. And if anybody else around you ever seems ill, disoriented, consider the fact that it could be dehydration. I had a very scary experience a couple of months ago with my mother, who stood up we had just had dinner, and she stood up from the table, and she took, like a couple of steps toward me, and then she said, "Gee, I feel a little dizzy and fainted right into my arms. So it was dehydration. Okay, small changes make a big difference. Okay, so you don't have to change everything all at once. I hope I didn't overwhelm you. If you need help with where to start, you can call and make an appointment to see me. I'd be happy to talk about any of these topics further. And anybody have any questions? Yeah?
With the dehydration, is it better to offer a sports drink with electrolytes, et cetera, versus water, or is water enough?
Depends on the situation. Usually water's enough if we're talking about an older adult. If it has to do with, usually the sports drinks are better on exertion. I mean, if anybody's been out, if somebody's been out doing gardening and that's why, then, but it's, yeah, it's just water itself would be the first and foremost. Yeah?
I noticed you didn't omitted meat, beef, pork, and so forth.
Yeah.
Why did you do that?
Well, it certainly is not going to help your health. Limiting beef or any type of red meat intake and pork is the commercial would like you to think it's another white meat, but it's not. Any of these animal products actually, in 1 to 2 meals a week, are not unhealthy, but certainly not bringing anything into your diet to make you healthier. You have anything about meat that you think is a healthier? Yeah, that's the only reason why I eliminated it, because I was just focusing on the foods that are going to improve our health. And certainly meat 1 to 2 times a week is not unhealthy. 1 to 2 meals a week, and it would not be harmful. If somebody were eating more of it, I would just think that it would be more of an inflammatory diet and could be harmful. And it's very individual. I mean, some people are more affected, or some people have more cause and concern to eliminate some things from their diet than others. Certainly, if somebody has a situation and they find that another particular way of eating is going to be more therapeutic, then that's what they would tend to do. But in general, animal proteins bring fats into our diet that could increase the inflammation in our diets, and also probably eliminate or reduce the healthier foods. If you think about it, you go out for a steak dinner, and in general, wouldn't you get like a big hunk of steak, and maybe you'll get, what, a baked potato and some cream spinach? I mean, if you think about it, and I'm just trying to come up with like the worst case scenario. I mean, isn't that, and you could do that and splurge. Somebody might do that and splurge on that when they're celebrating a special occasion, but I know people that eat like that on a regular basis, and that would be not healthy. And it's not what we do all the time. It's not what we do that hurts us, like if we're doing it sometimes. It's what we're doing all the time, what we usually do, that could be harmful. If you go and have, a big ice cream sundae every once in a while because you really love it, that's not going to impact your health. But if you're eating like that every night, it probably would.
So eating animal protein every day is not a good idea?
White meat, chicken, and fish is lower in fat and therefore leaner and healthier for the heart. Anytime you're eating saturated fat, you're actually not eating something that's healthy for the heart. It's not necessarily, I mean, if you only enjoy dark meat chicken, then you're eating more saturated fat than if you mix it up between the white and the dark. And if you stick to just the white meat, chicken, and fish, you're eating a leaner diet, and it's healthier because you're taking in, it's the saturated fat that you eat that turns to cholesterol in the body. So if you don't eat it, you can't build up the cholesterol in your blood vessels. Yeah?
I personally prefer nutrients. I've been taking, my wife and I have been taking for over 50 years now. We take no medication. I'm almost 80.
Awesome.
I'm healthy.
So you're taking supplements?
Yes. Because today you buy vegetables. Where are they from? Chile.
Right. Well, that's...
You know why? They have DDT down Chile.
Right, but that's why we were talking about eating organic, right?
Sold it to Chile.
Right.
They use it, and I never buy any fruits and vegetables.
Well, just as a plug, though, starting from June to November, here at the lab, you can be part of the Organic Farm Cooperative. And once a week, you get a bag of fruits and vegetables right here in Berkner. I've done it for the past, 4 years or so. And it's grown at Green Thumb, which is out in Watermill. And
I think it tends
I'm sorry?
10 sittings a day.
10 servings a day.
Fruit.
No, fruit and vegetables combined.
Yeah.
Combined, okay? So if you have a cup of salad before you have dinner and you have a cup of broccoli with dinner, that's 3. Because it's a cup of raw and half a cup cooked. So you have 3 servings right there at that meal. If you have lettuce and tomato on your sandwich and baby carrots as a side dish with your lunch, that's 2 more, that's 5. If you have 2 or 3 pieces of fruit a day, you hit 8. So and if you're eating the fruits and vegetables, you're pushing out, like for instance, we were talking about the sugars, okay? I happen to have a sweet tooth, all right? Last night I cut up some fruit that was so sweet, it was like eating candy, right? So you can use fruit as a sweet snack. You can mix fruit in a non-fat yogurt, because the non-fat yogurt, you might say, oh, that's tasteless and I don't enjoy it. But maybe if you stir in a cup of berries and the blueberries, it's May. The blueberries are coming from New Jersey now. They're fresh and local. The healthiest way to eat is local and in season. So all winter long, I've been living on, kale, and that's what is available. Those hardy greens are available in the winter, and the squashes and things. And yeah, the summer everything is brighter and more colorful, and maybe there's more abundant. But anyway, and there is, depending on where you shop, and that's why I said sometimes you have to be selective as far as the organics. Yeah. The whites, you're going for the wheats. Good, okay, good. Well, the only reason why is because you could see it was like there's so much information, and absolutely, and the more whole the grain, the more nutrients in it, because the more processed of it's being stripped of those nutrients. So the first thing that happens is if you're not eating whole grain, you don't have the bran part of the grain, which is very important to the body. Once they strip that away, you lose fiber and B vitamins. So it's very important to be eating whole wheat, whole grain, absolutely. It's very difficult to do. You have to be really conscientious.
Well, once you do it once, you've done it. It's not in the kitchen, so far we've all survived pretty well.
Yeah.
My wife gives my kids juice a lot, and I've been an advocate about drinking water and eating.
Exactly, absolutely. Very important. I'll tell you why, for a couple of reasons. One is that the juice actually has removed the fiber. There's no fiber there. So the body is absorbing juice in 10 minutes, where it would absorb the fruit in more like 30 to 40 minutes, because the body has to actually break down the fiber. The other thing is that studies have proven that drinking calories does not eliminate calories that we eat. It only adds to it. So if you have juice with a meal, let's say, they have found that out of 150 calories in an 8-ounce glass of juice, it has added 104 calories to the meal. Okay? So it is never a good idea to eat the juice. It would be drink the juice. It would be much more beneficial to be eating the fruit. Okay? Once it's processed, anything processed is going to be less nutritious. So, and it would also make them drink more water, which is also very important. And if they never have any calories from beverages, then chances are they'll be able to manage their weight more easily. They find that the obesity or overweight among children is a lot of it is from the beverages, sodas, juices. I happen to not want to bash chocolate milk, because as far as I'm concerned, it's important for kids to drink milk up until the age of 22. And if the best way to get it in, if you can get it in an extra serving by putting a little chocolate in it, it is so much healthier for the body. So I don't bash the chocolate milk. Yeah?
I see that you're recommending the vitamin C levels from 500 to 1,000 milligrams.
Yeah.
I was just wondering offhand what the government RDA level is for that particular vitamin.
The RDA is 60 milligrams to prevent scurvy. And they suggest 75 to 90 would be like the minimal, like a daily intake in food. The 500 is where they usually start out suggesting supplement use if you want to use it as an antioxidant, so that vitamin C is one of those that are flushed out and eliminated from the body. We don't store it. So the only people that have to be careful not to take too much is if you are prone to kidney stones. I would ask the doctor about taking more than 500. 500 should still be safe, but I would ask the doctor about taking anything if you have kidney stones. Yeah. No, that's okay. Was there a follow-up question?
No, is it true that the liver needs at least 2,000 milligrams of vitamin C to maintain the bone function?
That I've never heard. No, I'm sorry. Do you have any research you could send me if I gave you my email address? Yeah, I would love to. I would love that. Yeah, thank you.
What's the big deal if you don't have any dairy in your diet? Like no cheese, no milk?
Any dairy? Would you? No, you do not. But would you take a calcium supplement then?
No, I do.
Then that's fine. No dairy you do not need any dairy in your diet. Okay? You do not need any dairy in your diet. You do need calcium, okay? From the age 22, the body stops absorbing calcium into your bones and starts the breakdown process. Unless you're going to maintain the calcium in your bones, you are not going to maintain your bone health. As long as you're taking calcium. And I would also suggest that once you hit mid-40s or perimenopause, you ask the doctor for a baseline bone density scan. And
I get them done, the density scans done, that's the activity process, I've had several times.
fine. As long as you're watching, that's it. Because if you can catch bone loss before it becomes, if you can catch it at osteopenia where it's weakened before it becomes osteoporosis, it's much easier to reverse.